ADHD could be an even bigger problem than doctors and parents actually think it is. Analyzing data from the Centers for Disease Control, the New York Times found nearly 20% of high school-age boys and 11% of school kids overall have gotten a medical diagnosis of attention deficit hyperactivity disorder. So is ADHD on the rise, or are doctors getting better at recognizing it? For some insight, I'm going to turn to Dr. William Graff, a professor of pediatrics at Yale School of Medicine. Dr. Graff, good to see you. So what's your reaction when you hear these numbers? Nearly 1 out of 5 high school boys with ADHD?
Well, Federica, these are pretty impressive numbers. I think the rates are real, but they may be artificial at the same time. They're rising in a rate of doubling or tripling. And I think the question we should be asking is not whether ADHD is a problem for some people, but rather why are the rates rising so rapidly.
So what's the explanation as to the definition of ADHD? Are you so certain that the symptoms or the characteristics that are being, I guess, measured in young kids, are they accurately being defined as that of ADHD?
Okay, so ADHD is a very complicated disorder. It's a combination of 3 major symptoms or signs, and it's an interpretation of what those signs really are by parents, teachers, and physicians. So those 3 signs are hyperactivity, inattentiveness, and impulsivity. And kids can have any combination of those 3, and parents can interpret those symptoms differently. There's probably also a mild, moderate, and severe form of this, so part of the rise could be that milder cases are either being picked up or being diagnosed more rapidly.
So when do you know that any of these things, hyperactivity, inattentiveness, impulsivity, are actually problems or are things that need to be treated as symptomatic of ADHD?
That's exactly right. This is the most important aspect of this diagnosis, is that it actually interferes with your ability to perform neurologically. For children, that means getting through their day. We call it in medicine functional impairment. It's an impairment. It's a neurological disorder. And I think many kids have traits of ADHD. They can be distractible. They can be a little bit agitated at times, but that doesn't necessarily make the diagnosis. So one of the big questions is whether milder cases are contributing to these increased rises in diagnostic rates.
So is there a rise in cases, or is it that there are more diagnoses taking place?
There are more diagnoses being made. And then the question is, what accounts for it? Are kids changing? Is it lack of sleep or inattentiveness or too much computer time or not enough exercise? What is the cause there? Are we recognizing it better? Are they just milder cases? And I think most people agree that some proportion of the rate and rise is due to something called pediatric neuroenhancement, which means the drugs are being prescribed for the purposes of study drugs. And since that's not exactly legal, we don't have good data on that because people won't own up to how many prescriptions are actually being written for school purposes.
And so how concerned are you about medication, long-term medication, I guess, effects or prescriptions?
I think we're very concerned about it, especially in kids who don't have the disorder. If kids are mild and can get by with behavioral or educational techniques to manage their ADHD traits, or for kids that are healthy and are actually taking it for study drugs, what we know is that there are some cardiovascular potential side effects. There are some central nervous system potential side effects. And lastly, there are changes that we don't know that much about in the long term, how this would change your mood, your ability to think, your feelings, and things like that. There's not much research on how these drugs, especially the amphetamines, would change your personality.
Do you worry that too many kids are being medicated and they need not be?
I think the numbers show that there's a very good possibility that there's overdiagnosis and overtreatment going on. And I think the question we have to ask ourselves, we have to have this larger discussion as a society, is why is this happening?
Dr. William Graff, thank you so much.
Thanks, Federica.